Good morning, everyone. The committee will come to order. Today we will examine the FY19 budget request for the Indian Health Service. I'd like to thank Rear Admiral Michael Murkowski, the Acting Director for the Indian Health Service, for appearing before us today. I think we all know that the head of IHS is a tough job. It is a hard job, but it's also a very critical one for us, whether you're in Alaska or New Mexico or wherever. Certainly in Alaska, where health care for Alaska Natives is delivered through compacts between tribal organizations and the IHS, we take a very keen look at all that goes on through IHS, and Admiral, you certainly know that. Director Murkowski is accompanied by Rear Admiral Michael, am I saying it right, Tote, who is the Chief Medical Officer at IHS. Gary Hartz has been before the committee multiple times. He's the Director of the Office of Environmental Health and Engineering. And we're also joined by Ann Church, who is the Acting Director for the Office of Finance and Accounting. So we welcome all of you. The IHS budget request for FY19 is $5.4 billion for programs within this subcommittee's jurisdiction. This is a decrease of $114 million, which is 2% below last year's enacted level. The budget proposes to change the Special Diabetes Program, which provides $150 million annually, from a mandatory spending program to one subject to the discretionary appropriations process. However, Congress has already passed legislation to maintain this program as mandatory funding for FY18 and 19. This is a course going forward that I certainly support. I'm pleased that the budget request provides full funding for contract support costs by maintaining the indefinite appropriations language that I first included in FY16 Approps bill. This has helped provide certainty for tribes and protected other IHS programs in case additional funds are needed to meet the government's legal obligations. While this is an important area of agreement and this budget has less reductions than others we have seen in this subcommittee's jurisdiction, I am very concerned that the budget request does not adequately meet the needs for health care delivery in Indian country. The facilities appropriation, it's cut by 42%, from $867 million to $506 million. And this is a tough one for me to understand when we have a current backlog of facility on the services construction list at over $2 billion. The total need for facilities construction across Indian country is estimated at $14.5 billion. So again, you've got incredible need, and we're seeing a pretty significant cut being proposed. I'm also concerned that the budget does not adequately address the opioid epidemic. This has been especially acute for American Indians and Alaska Natives, and unfortunately the statistics that we see are shocking, they're intolerable, and we must act. We must address them. According to the service's budget justification, American Indians and Alaska Natives had the highest drug overdose death rates in 2015. Equally distressing, the justification shows a 519% increase in drug overdose deaths from 1999 to 2015, which is the largest percentage increase of any population out there. So this population of our Native people are dying of overdose deaths at a greater rate and a greater percentage than any other population in the country. The CDC has also reported that American Indians and Alaska Natives consistently had the highest drug overdose death rate by race every year from 2008 to 2015. So when we're looking at opioids specifically, overdoses have increased fourfold during this time frame. I know it's an epidemic, it's hitting us all across America, but when we see, again, the impact to this population, it does cause us to question, and rightly so, what we are doing, because it certainly is not adequate. Now, your budget request indicates that the IHS will receive $150 million if the overall $10 billion request for opioid treatment programs through the Department of Health and Human Services Department is provided. But given the scale of this problem in Indian country, I would have preferred that these funds were requested directly within the IHS budget so that this subcommittee would have more control over ensuring that you have adequate resources to address this issue. For the last 2 years at these budget hearings, I have asked what steps the agency is taking to address the chronic problems with healthcare delivery in the Great Plains region. And I have yet to be convinced that the service has put in place an effective plan to address this issue. At last year's budget hearing with you, Admiral Murkowski, we discussed at length an article that had just been published in the Wall Street Journal. It was an investigation that documented multiple instances of patient deaths, just deplorable conditions at the Winnebago, Pine Ridge, and Rosebud hospitals. CMS removed the certification for some of those facilities so they could no longer bill Medicare or Medicaid, and as of July of last year, the Winnebago Hospital had not received recertification from CMS, and the Rosebud and Pine Ridge hospitals were still operating under system improved agreements with CMS. So I'll have an opportunity to ask further about that in my questions. In the Omnibus Appropriations Bill, the subcommittee took a number of steps to address the situation in the Great Plains and elsewhere in IHS. We doubled the amount of funds to address accreditation emergencies from $29 million to $58 million. We provided $11.5 million for staffing quarters to alleviate housing shortages for healthcare professionals, and we gave the agency new statutory authority to directly pay for housing subsidies for medical personnel to help with the recruitment and retention in remote locations like the Great Plains. So again, I'll be asking you for an update on the situation there and what specific steps you're taking to address those problems. I think the reality is that this quality of care, and I wouldn't call it quality, I would say it's a shameful quality of care, has gone on for far too long. So I hope that this morning you'll be able to give some assurances to the committee that the agency is on a path to finally resolve this situation. We have many questions for you. We appreciate your appearance before the committee. I now turn to my friend and ranking member, the senator from New Mexico.